You're back? Good evening. My name is Haron Ndungu Kimani. Tonight we'll be sharing on a very sensitive yet quite important issue called depression. We have a targeted audience because this is definitely a platform that aims to allows awareness among us children with autism. And therefore, a major concentration will be depression in children with ASD or autistic spectrum disorders, primarily children as well as youth or young adults. Now, we shall be delving deep into understanding signs of depression in children with autism. However, we would start from the basic introduction of what autism entails or involves. Autism is a neurodevelopmental condition that affects children, majorly diagnosed from allowed the age of 2 years to and progresses through the growth and development of the child. The linkage between depression and autism is what we'll be looking into this evening. Depression, as every one of us knows, is a major depressive disorder that is common among the population, characterized by medical illnesses, which in one way or the other negatively affects how anyone who is affected feels, how they think, and how they live or act towards circumstances in life. And therefore, the biggest effect of depression is in how it affects our feelings by enlisting feelings of sadness, feelings of loss of interest in so many activities that typically would be effortlessly done or executed. And therefore, what happens is that the effect becomes dual in that it is both emotional and physical in its impact or consequences, the bearer of the depressive conditions. Now, from the research and what has been constituted within the World Health Organization, depression has been recognized as the single disease that has impacted largest public health burden because of its effect both emotionally, medically, and physically. And therefore, it is something that is important for us to have a deeper look into, and particularly when it relates to children. For a depressed child translates to a depressed youth and ultimately a depressed adult. Now, although it might be assumed that children with autism has been in a way protected from the rigors and effects of depression, viewers, the research that has been developed of late indicates the opposite, that yes, children with autism are also affected by depression. We'll be going into looking at the challenges as a start that confronts researchers, caregivers, and any person who works with children with autism in diagnosing autism in relation with depression. Or what are the challenges that persist in helping us diagnose depression in children with autism? Now, one of the major challenges is the fact that autism and depression almost carries similar characteristics. We call them phenotypic overlap. That implies that how autism is expressed in children with autism in terms of their characteristics and symptoms is almost closely related to how depressive symptoms manifest themselves amongst children. And therefore, there is little or no major difference between the symptoms of depression in children with autism and the tendencies or characteristics of autism as a condition. That is why we are talking about symptomatology overlap. That is, the symptoms overlaps between that of depression and that of autism. Now, second aspect or challenge that really affects the diagnosis of autism is the fact that we have what we call challenges in communication. Majority of children with autism are affected by communication. That is what is normally called delay in expressive speech, delay in receptive speech, and therefore their inability to actually express how they feel, what they are experiencing, and actually helping the people who are caregivers primarily understand what they are feeling. That in itself becomes a hindrance because major depression is recognized or diagnosed as a result of someone expressing his feelings and his emotions. But when it comes to children with autism, it becomes a little bit difficult because those children cannot express themselves, or if they can, it may really not achieve the targeted expectation in terms of the alignment of the nature of speech that they have. And that makes it difficult for caregivers, for psychiatrists, and for people who deals and works with the children understand what actually is ailing the children. The other aspect of challenge that confronts is in attempting to diagnose autism is the fact that we have what you call the theory of the mind challenge. The theory of the mind is an exemplification of a situation where a typical person is able to express him or herself from the dimension of what is being experienced innately. Now, when it comes to children with autism, it becomes almost a challenge to actually express that which is inside of them. And therefore, the theory of the mind becomes a limitation in as far as us understanding what a child with autism is going through. They have a serious and yet a very sensitive challenge in trying to bring a link between the experiences, between the mental state, between what someone is experiencing to the real life situation. That which we typically would embrace as the tendencies and the characteristics that will help us diagnose depression in typically growing children becomes a little bit difficult for us to exercise the same among the children with autism. And therefore, that is a challenge by itself. We want to go through without wasting a lot of time on what you call signs of depression. Now, before we delve deep into signs of depression amongst children with autism, it is paramount to understand that children with autism vis-a-vis children without autism have clear discrepancies in as far as the expression of symptoms is concerned. When we are dealing with children with autism, we are dealing with a group of children who may not typically present signs or symptoms as a typical child would. And that implies we have to utilize alternative means of identifying that a child is experiencing depression, different from what we would utilize from a communication angle, an expression angle with a child who is typically growing. And therefore, one of the signs that manifests depression amongst children with autism is intensification of autistic symptomatology, or what we could alternatively see as decreased interest in preoccupations. Now, this is majorly on restricted activities. What do I mean with this? A child with autism primarily may be reflecting certain characteristics, tendencies, or symptoms. But as a sign of depression, what really actually helps us understand that this child is undergoing depression or experiencing depressive characteristics is that there is a sense of heightened activity in regard to the characteristics and symptoms that previously had been experienced by the child. So necessarily that becomes a red light, a signal to us that this child would probably innately or outwardly be experiencing something that is uncomfortable and something that would actually trigger what we are talking about in regard to depression. Now, when, for example, a child who was hyperactive becomes all of a sudden excessively hyperactive without any sign of the cause of hyperactivity, that may imply that the child is experiencing depression. A child who was experiencing self-injurious behaviors and all of a sudden starts showing or manifesting more intense self-injurious behaviors like banging himself on the wall, self-biting, that is an implication that we would want to start evaluating the child from a depressive angle. The other alternative in terms of changes in symptomatology is in terms of the child becoming worse than the way he was. If a child was hyperactive and all of a sudden, from nowhere, you realize that the child is spending more and more time alone, hidden himself, or in isolation, without necessarily anything that would have allowed such a change of behavior. It is important for us as caregivers to really start looking into the emotional and physical well-being of the child, because it would mark a trigger of depression. The second sign of depression is what we call emotional lability or labile moods. Now, that is clear and more physically manifested through a rapid change or exaggeration of the symptoms that were there without notice. Now, you realize that a child who was calm, quiet, with a little bit of hyperactivity here and there, not necessarily out of control, But then suddenly, with a lot of exaggeration, or what you can term as extremity, that child starts, breaking off the limits of the baseline. And the baseline in this case, I mean where the child was initially. There is an upshot of, behavior dimensions that actually affect how the child interacts with the immediate environment. Now, that is called emotional lability. It's quite an unexpected upheaval in the feelings and the environmental disposal of the child. And it affects the child in a way that even the primary caregivers may really not necessarily understand what is happening in the child. It is important once such an experience happens for the caregivers, teachers, psychiatrists, or whoever is near the child to start looking deeper into what would be triggering such, movements or behaviors. Because to be honest, the triggers may be depressive in their sense. The third aspect of helping us understand and discern that a child is experiencing or undergoing through a depressive state is a situation we call catatonic behavior. Catatonic behavior is when a child experiences what we call a disruptive awareness of the world around him, that all of a sudden the child is no longer aware of where he is, of the people around him, and what he ought to do, even within what we call familiar surroundings. Now, this may happen even amongst the typically growing children or adults, but then because our major area is children with autism, may be reflected by a child or over the life of the child, a child who necessarily would be able to locate his directions and dimensions within a certain environment, but can no longer be able to move around or to help himself in understanding where he is in relation to the environment that he has been put in or has found himself in. Now, that is usually a concern and an evidence that something that is deeper may be happening in the life of that child. And it is important that each one of us may look much more keenly and deeper, move from the superficial and try to understand what actually is ailing the child so that appropriate support system may be introduced and put in place. The next characteristic that we should observe, and particularly among the children with autism, is what we call decreased adaptive functioning, very, very important, and particularly in areas of self-care. Now, because these children may not necessarily express themselves verbally, what helps us is by understanding whether the children can actually function adaptively within the environment and undertake activities that they have been undertaking without failure. These activities may include toileting. These activities may include self-feeding, basic personal hygiene, areas of interest that the child may be engaging in, aspects of awareness of dangers within the environment. Now, signs of depressions manifest themselves in such a child by having the child unable to cater for his or her immediate needs. A child who was okay in toileting shows regression in such an activity. A child who would comfortably avoid danger all of a sudden becomes a little bit careless or what may appear like ignorant of danger, because that no longer matters. A child who was, able to bathe himself or herself is no longer able to take such an important hygiene task. That also includes feeding. Children who were properly able to feed themselves all of a sudden starts relying on being urged on, encouraged to it, because they can no longer do it independently. Those are signs of a change in inner emotional states of the child, and important signs that each one of us must seriously and critically observe in the child. The next characteristic or tendency that we can look into as caregivers, teachers, or professionals working with the child is increase in self-injurious behaviors. These are instances where a child who has been engaging in, a little bit harmless self-injurious behaviors intensifies in them, the extent that the infliction becomes more effective in the health of that child. For example, a child who would necessarily bang him or herself on a wall, or try to bite his arm, or try to do things that would harm himself, actually exacerbates the situation by doing them more violently and rigorously. It is important for us to try to ascertain why such a child is all of a sudden started becoming violent to him or herself, and what would be the triggers of such a reaction. A child who would not really mess so much by hitting himself, biting himself, why should that be all of a sudden uh, increase? What would trigger that? What are the environmental circumstances that may necessitate such a behavioral reaction? That is a symptom that has always uh, been manifested, in particular for us who have spent years working with children with autism. Those are some of the signs that really allows us our curiosity and our seriousness, so that we may be of help to these children. Because if you'd ignore such red signs, you would risk losing the child for quite a great duration of time, and therefore affect the implementation of the relevant programs and that you would have put in place. Therefore, it is important for each one of us, important for every caregiver to really understand and be able to tell the changes in the emotional state that are experienced by the physical increase in self-injurious activities. We want to move to the next characteristic that you would want to identify and check on, particularly when you're dealing with children with autism, to know whether there could be any sign of depression, any aspect or appearance of depression, and therefore do the appropriate step that you need to do in terms of medication or behavior change modification in the life of that child. And the other symptom that you'd want to check on is called anhedonia. Anhedonia comes from the English word hedon. Hedon is from explanation of pressure, and a majority of children with autism would suddenly lose pressure on the things they actually enjoy doing. I've seen this, that a child would be primarily enjoying, jumping on the trampoline, doing his swings, attending his or her therapist and enjoying it with a lot of pressure accompanying the programs. Then all of a sudden, this boy or girl withdraws and no longer is interested with the activities that elicited joy and joy and pleasure. Therefore, it is important to identify such scenarios that why is it all of a sudden this boy or this girl has lost or become disconnected from the activities that previously would become a source of enjoyment. Why would she lose interest in what actually brought joy? This is as a result, or majorly would be as a result of experiences that the child may be going through whose impact in the life of that child may not be really positive. And therefore, without dismissing the symptoms or the characteristics that the child is manifesting, it is our duty, our responsibility, and the desire of every parent, caregiver, teacher, or professional dealing with such a child actually do a closer investigation to help the child understand the background behind the immediate disconnection between what he or she previously enjoyed and how he's behaving presently. So anhedonia, therefore, is sensitive tendency or characteristic that shows that the child may be experiencing something more than we can see from the physical eyes. Because again, these are children who may not necessarily express their feelings and emotions because there is a disconnect between the two. And therefore, the most important thing is to really learn what they are experiencing by observing what they are doing or not doing. And part of what they are not doing is deriving joy, pleasure, and satisfaction from the things they were excited of doing there before. We move to the next characteristic or observable signs, which from my description was an overall marked or marked change in behavior from baseline. In this case, I mean from the observable point of view as a caregiver, if you realize that there are behaviors that have started showing up far more or below what the child was there before, that's what we are calling the baseline. This is what has characterized my child. And this is what the child is now experiencing. Any change, any marked difference from that baseline should elicit concern if it was not meant as an intervention through therapies to help the child acquire specific skills or abilities. And if it's behavioral in nature that has changed the child to the worse, then it is an evidence that whatever is happening inside of the child needs attention and concern from every one of us. So anything that goes beyond or below the baseline, behavior-wise and expressive-wise in the life of the child, is an impression that there's something that is out of miss in the life of that child, and therefore something that should actually, in essence, cause us to take a step. We're moving to the next aspect of our learning this evening. We want to look into a few risk factors that are related to children with ASD and the comorbid of depression, because depression acts as a comorbidity in relationship to autism. Now, what are the potential risk factors? In instance, I want to look into what would be the trigger for depression. We've looked at the characteristics and tendencies. What would be the potential triggers? I'll just highlight 3 of them, but then there are quite a number of triggers. And one of the major triggers is, the effect of the environment, the experiences in the environment. We usually call them environmental stressors. Environmental stressors are majorly what is associated with depression in autism, because that is what affects major children, and not just children, but also adults as well, and determines how they express themselves in relation to the environment, and actually how they adaptively live their lives in comparison to how it was there before. Now, the environmental stressors may be events, occurrences, or circumstances that the children have witnessed in their lives. It would be probably change in geographical environments, shifting from one house to another. It may be probably change of schools, it would be change of teachers. And when we all of us adapt to that by verbalizing our feelings, children with autism will majorly act and react as a response to how they feel inside of them. And therefore, the symptoms that we've just looked into. The most important thing is to help the child adapt within the environment that he or she has found themselves into. Otherwise, the ability to live beyond and past depression may really not be enabled or overcome if we really do not seriously look into ways of building adaptiveness in the lives of the children. And that is one of the life skills that we always advance. We help a child adapt to the environment, different environments at different times. Our children are rigidly routine-based, but then by enabling them, gradually with the introduction to different environmental surroundings, will help equip and strengthen their inner abilities to maneuver and establish themselves in whichever environment they may find themselves in without triggering depressive tendencies. Now, the other aspect of risk factor that may be associated with autism and depression as a trigger is the age of the children. Now, you realize that a majority of children who are teens and who are actually a little bit self-aware are affected much more by depression than those whose concept of self-awareness is actually a little bit below par. Adolescents and youth with autism who are able to interact with their fellow typically growing teens and youths who have been found through research to be affected much more by depression than those who actually do not realize, understand, or have a sense of self-concept or awareness of who they are. And therefore, the fact that they are aware of who they are within a mixed group of fellow youth or teenagers becomes a huge trigger of depression in their lives. The fact that they will start comparing themselves and asking questions questions which may not necessarily be verbalized, but which will trigger a reduced sense of self-concept and therefore affecting how they rate with themselves and rate with the environment at large. That is very, very important to therefore help the child be able to adapt appropriately in the groups that they may find themselves in, and probably help build what you call buddies, personal buddies, teenage groupings that help socialize the child, empower the child, and enable the child, even from the teenage or youth perspective, in building an enabling environment that nurtures self-confidence and an appropriate sense of self-concept. This will go a long way in building the right mental health in the life of that child. Therefore, those are some, but not all, the risk factors that are associated with depression in children and youth within the autistic spectrum disorders. We would want to look at the potential treatment of autism. Now, the greatest confusion through research has been noted in the treatment of depression in autism. And why do I say this? It is a little bit challenging for us to clearly demarcate the treatment of autism and its characteristic as a condition, and the treatment of depression and its characteristics, because both of them have similarities, and the similarities that are within the two comorbid conditions indicates that their treatment or the medicinal aspect and dimension of treating depression is closely, or close to that which treats the condition of autism. We've seen that the antidepressants that the children with autism will majorly utilize are similar to those that typically developing children and adults with depression would get as prescriptions. And therefore, that really brings a lot of controversy in the treatment of depression in children with autism, because what has been prescribed to treat ADHD as a condition is probably what will be prescribed to treat depression in the child with ADHD or the child with autism, complicating the treatment. However, the advice has always been and is that in the pursuit of medication and treatment for depression, and particularly among children with autism, the most advisable thing to do is to seek medical counsel. That is what will give an appropriate and proper model of treatment. Otherwise, we may really not achieve a lot in as far as the treatment of depression in children with autism is concerned. What has been put in place, though still with a lot of controversy, because it is still the treatment for autism and its conditions and the characteristics associated with autism. It is what we call psychosocial intervention. And psychosocial interventions entails activities such as cognitive behavior therapy. Now, it is from experience and from all of us who deal with children with autism, it is clearly known that positive behavior therapy is part of behavior modification strategies for children with autism. And yet, this is also a counsel and an appropriate designated pathway for psychosocial intervention among children with autism. And that is why from the beginning we agreed that autism and depression almost are in a collision course, both in their diagnosis and yet still in their treatment. The challenge that emanates from depression in children with autism and the treatment of children with autism is almost a similar discourse that all of us must explore and courageously advance and confront. Because we need treatment and medical treatment. Yet still you need psychosocial support in the form of interventions, behavioral therapies, which still will have to employ in children with autism to try and manage the condition itself. So these are things that the professionals must be consulted when you would want to enlist the or an appropriate treatment for depression, because in the long run it will look like there is an overlap, as we agreed, between the symptoms of both conditions. I would want us to look into the conclusion of our talk and conversation this evening. Now, we have agreed as a people that autism, depression in youth and children with autism is quite difficult to diagnose. This has been supported by the fact that there is what you call phenotypic overlap. That which is manifested physically and outrightly between the two groupings and the two conditions is similar, or there are similarities in symptoms. And the similarities makes it a challenge for all of us to be able to diagnose autism. Depression in children with autism. But then we've also agreed that apart from looking at what the child expresses, him or herself, in regard to how they feel, we would want to listen to, I would want to use the word listen to what they do by observing what they actually do. Because this is a direct manifestation of the inner operations and experiences that the child is going through. By observing the dynamics of the behaviors of the child, we're able to tell how the internal environment is, and therefore bridge the widened lift or gap between emotion and feeling in regard to our inability to get what the child can express in. Now, we also have to agree that beside what, or in the absence of what the child says, speaks, or expresses him or herself in, what is important for a caregiver or any professional dealing and working with a child with autism is what the child speaks through actions. That must be a conclusive agreement for all of us, because that is ultimately what will help each one of us working with such a child explicitly diagnose and tell what is actually ailing this child. In the absence of critical observation and understanding of what the child is experiencing, we may never actually tell that the child is probably suffering from depressive conditions, and therefore we may never alleviate, help the child, or empower the child in overcoming depression. Therefore, observations, following up, being present, and actually noting and identifying the smallest changes in behavior above or below the baseline is critical in our assessments and in our diagnosing. Now, there may be lack of diagnostic tools that are exclusively for depression in children with autism, but then there is one called ACI-PL that has been developed to exclusively work on children with autism. Is a very critical and important diagnostic tool, because in the absence of all the others, we may have one that actually would marry between the condition of autism and the comorbid of depression to help us exactly ascertain the conditions and the symptom of depression in children with autism. We have reached a juncture of question and answer session. If there be any question based on what you have gone through, I would want to have an interaction on the basis of the same. Otherwise, thank you very much for being part of this great audience and our learning this evening. It's been pleasure being with you. Thank you, everyone who has been online, learning with us, and experiencing this great journey as far as helping our children with autism is concerned. Therefore, thank you very much. Have a wonderful evening. We've come to the end of our podcast.